Dear students, welcome back. In this session, now we are going to discuss about the lumbar triangles, which is located in the posterior abdominal wall. And this lumbar triangles are of two types. One is the superior lumbar triangle and inferior lumbar triangle. So here you can see this one is the inferior lumbar triangle, which is also can be seen somewhat on the lateral aspect, this inferior triangle. And another one is the superior triangle, which is present adjacent to it. So this is the superior triangle, and this inferior triangle is also called as petit triangle. So this triangle was first described by Jean-Louis Petit, who is a French surgeon in 17th century. And if you can see the borders of this inferior lumbar triangle, inferiorly it is formed by the iliac crest. Here you can see inferiorly it is formed by the iliac crest. And if you can see this, anteriorly it is formed by the external oblique muscle, and posteriorly by the latissimus dorsi. If you can see the floor of this triangle, the floor of this triangle is formed by the internal oblique muscle. So this is called as inferior lumbar triangle or petit triangle. Normally 70% of traumatic lumbar hernias occur through this inferior lumbar triangle. Now we will see the superior lumbar triangle. So the superior triangle is also called as triangle of Greenfeld and Leschaft triangle. Okay, so these two are also surgeons who described these triangles. Greenfeld, he described the superior triangle in 1866, whereas Leschaft described in 1870. So now we'll see the borders of the superior triangle. So here is the schematic representation of the superior lumbar triangle. The superior lumbar triangle is having borders. Superior border is formed by the lower border of the 12th rib. Here you can see this is the 12th rib, lower border of the 12th rib. And medially, so this one is medially, it is formed by the quadratus lumborum muscle. This is the quadratus lumborum muscle. And laterally it is formed by, this is lateral and medial, laterally it is formed by the internal oblique muscle. So this one is the internal oblique muscle. If you see this, if you can see the floor of this superior lumbar triangle is formed by the transversalis fascia and the aponeurosis of the transverse abdominis muscle. Okay, and also roof is formed by, normally this superior lumbar triangle is placed somewhat deeper than the inferior lumbar triangle. So many muscles are covered this triangle. So the muscles covering this superior lumbar triangle is the latissimus dorsi and external oblique muscles. Actually here you'll get the actual superior lumbar triangle, and this triangle is covered, that is roof of this triangle is formed by this latissimus dorsi and external oblique muscle. If you go the floor, so you'll get the peritoneal layers, isn't it? Before that peritoneum you'll have this transversalis fascia and the aponeurosis of the transverse abdominis muscle. Okay, so these are all the borders of this superior lumbar triangle. Here you can see the inferior lumbar triangle also in this schematic representation. So the hernia which is caused through this superior lumbar triangle is very rare. Okay, most common hernias, that is traumatic hernias, is normally occurred in the inferior lumbar triangle. So the cause for superior lumbar triangle is also trauma, any injury, trauma or injury, or any surgeries. Okay, so these are the two common causes for causing the hernias. Okay, and then if you want to see this hernia pictures, here you can find how this hernia is coming out. So this one is the lower, that is inferior lumbar triangle. So here hernia in the triangle of Petit, and this is the inferior lumbar space. And if you can see, this is the 12th rib here. So 12th rib superior border is formed. So this one is the superior lumbar triangle. In that space you can see this hernia. So these are the two hernias which are occurring in the inferior lumbar space and the superior lumbar space. Okay, so this is all about the lumbar triangles and the hernias related to this lumbar triangle. Thank you.